Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Gonococcal infection. Squamous epithelium is resistant to gonococcal infection. Most common site of asymptomatic carriage of gonococcal infection in females is endocervix. Other sites are urethra or Bartholin glands. Gonococcal vaginitis is not seen in young females. Theoretically, gonococcal vaginitis can occur in newborn females because vagina in newborn females is lined by transitional epithelium and vagina in adults is lined by squamous epithelium, and squamous epithelium is resistant to gonococcal infection. Spread of gonococcal infection. The gonococcal infection spreads from cervix to the uterus, causing endometritis, and from the uterus it spreads to fallopian tube and the ovary, causing salpingitis and euphoritis. From the fallopian tube, infection spreads to the peritoneum, causing peritonitis, and this peritonitis will heal by fine violent string adhesions. The adhesions between the liver capsule and the parietal peritoneum leads to perihepatitis called as Fitzhugh-Curtis syndrome. This Fitzhugh-Curtis syndrome will result in infertility and ectopic pregnancy.
Fitzhugh-Curtis syndrome will result in infertility and ectopic pregnancy.
thank you and thank you for watching.